Okay, so we have a lot of amazing life-saving technologies now, and these are things to help the heart. And technology is getting so wonderful so that these bulky things that used to protrude from the chest are actually like the size of a silver dollar. And things that we had to replace batteries often, sometimes the batteries will last 5 years or longer. And sometimes the charging is so amazing, it's just like having an iPhone. You just put the charger against the chest and it recharges the battery. So technologies to save lives are pretty amazing and getting more amazing as time goes on. But unfortunately, at the end of life, the question is, what do we do with these life-saving technologies? And so basically there's two kinds of life-saving technologies that are common. One is a pacemaker, and the other one is a defibrillator. And so just kind of summarize the difference. So a pacemaker just changes the rate. And so a lot of times when we have hearts that are kind of weak or sick, it doesn't keep up with the needs of the person's activity. So it may be too slow. So the pacemaker is like the natural pacemaker. It kind of says, well, your heart is kind of getting too slow and we need it faster. The pacemaker will kind of speed up the heart to keep up with the activity. The other one is the defibrillator, and that's just like the AEDs that we see in the shopping malls and whatever. If the heart goes into this rhythm that is life-threatening, it will shock the heart back into a normal rhythm. And so there are differences. And the one that we worry the most about in hospice is the defibrillator. Okay? So it goes by the initials ICD, which is implantable cardioverter-defibrillator. And so that's the question is, what do we do with that if they have it? And do we turn it off or leave it on? Okay? So anyway, let's get an idea of what other hospices do. Okay, so they interviewed 414 hospices to see what their policies were and what they decided to do with these people. And so they interviewed these people, these hospices, and 97% of the hospices says, bring them on. Just because they have that doesn't mean we'll turn them away. So I guess that means 3% of the hospices says if they have it, we don't want them. But 97% of the hospice says, it won't be a deal breaker in terms of admitting that patient, whether they had a defibrillator or not. Now, of those, 76% of the hospices actually truly admitted. So 97% said we'll take them, but 76% says we actually have patients who have defibrillators. And then of those people who admitted patients with defibrillators, 58% actually had it go off in the last year. So it does go off during these admissions when people have defibrillators. And they said, well, what are your policies? And of all those hospices, only 10% of the hospices actually had a policy to deal with defibrillators. We knew about it, we thought about it, but we don't have any formal plan of action. We just kind of think, well, we should someday come up with a plan, or we might do this or might do that, but only 10% actually have policies in place to deal with defibrillators. Okay. If they had a policy in place, then 70% of the hospices who had policies in place would actually turn off the defibrillator. But if there was no policy in place, then usually, well, we don't know what to do with it, so we'll just leave it on because we don't know if we should turn it on or off. So if the policy is in place and we're educated, then most likely we would turn it off. But if there is no policy, then only 38% would turn it off. And the other 62% would hope that it doesn't cause problems down the road. They asked, are you prepared? So they asked the hospices, how prepared are you to turn it off? And only 25% of the hospices actually had a magnet to turn off the defibrillator. So regardless of what the policy was or what their thoughts were, actually only 25% actually had a magnet to actually turn off the defibrillator. Okay. And even if you had a magnet, only 60% of the people knew what to do with it. It might have been there as a doorstop or kind of as a paperweight or whatever, but only 60% of people knew what to do with this paperweight, even if they had it available. Okay, so there is some training and some, education that could make our care for people with defibrillators better. So what I gave you as a handout is actually kind of a summary of what we should do, think about, and educate the patients with. And so it's actually a pretty nice summary. Okay. So the first part is the ethical rationale for deactivation. And so whether you have the defibrillator or not, we would admit you, whether you turn it on or off, most people, ethically, you should admit them, okay? So if they don't turn it off, it's not a reason to not admit a patient to the hospice. As a nurse or as a hospice staff, you want to ask the family or the patient whether they have a defibrillator, because that will kind of just help us decide how to best serve the patient. And so if we don't know about it, then we won't do the right thing. So at least we should ask. And a lot of times in our assessment or questionnaire, a lot of hospices don't have that question, do you have a defibrillator? And so if we don't have it or don't ask, then we should ask. Okay. And as a nurse, we should kind of assess if there's signs of a defibrillator or pacemaker by surgical scars. And because it's not a bulky box anymore, sometimes you may just have to press. You'll be able to feel this hard silver dollar under the skin, but before it was blatantly obvious, but now it's so subtle that unless you feel, you may not see it. Or this scar may be so small now that it may not be obvious that they have a defibrillator implanted. Okay. Now, if they do have a defibrillator, then you want to ask if they have an identification card that tells what kind of defibrillator they have, because how you turn it off varies according to the manufacturer and the company. And so most people get this card that they keep in their wallet or their purse that describes what the device is, who manufactures, how to contact them. So if we need to turn it off, we have information. So it's not something we want to scramble looking at the end of life. We want to try to find out about this upon admission. Okay, we may already be doing that, but something that as a reminder. The things that we want to educate the families about is that if the device goes off, potentially people will feel discomfort. So they may feel this shock and this jolt of things, and if it goes off multiple times, it may add to the discomfort of the person who is experiencing it. Now the question came up, well, how in the movies, everybody has to back away from the patient. So do the people around feel the shock? And unlike the movies, probably not. Otherwise, these defibrillators will be going off during the day and everybody holding hands or, hugging will be shocked. Usually the voltage is much less than what we do in the movies, only because in the movies we have to do it from the outside. This is implanted, so it takes a lot less voltage to do the same thing because it's right next to the heart. So probably the people around probably won't feel anything, but the patient might. Okay. So one thing is leaving it on could cause some problems. Turning it off doesn't necessarily mean that the person will die sooner. And it doesn't mean that if you leave it on that it's going to prolong life. It may, but it doesn't mean that it will. But also turning it off doesn't necessarily guarantee that it will hasten life either. So it really depends on the situation. Some people worry that turning off a defibrillator is painful. It is not. It's very easy to turn it off, and the patient won't feel turning it on or off. It's kind of a behind the scenes type thing. Sometimes turning off a pacemaker may affect a person's symptoms. So turning off a pacemaker may be different than turning off a defibrillator. So a pacemaker may be used routinely because it's affecting the heart rate. So if we turn off a pacemaker, it may actually affect the patient's ability to function or fatigue or whatever. But usually the pacemaker is not the one that shocks the person and makes it uncomfortable. It's usually the defibrillator. So again, there's a distinction between pacemaker and defibrillator in terms of leaving it on, turning it off. Now, if we decide to turn it off, it's kind of a big deal to turn it off. And so if they're ambulatory, then the easiest thing is to have them go to the cardiologist and have it turned off. If they're not ambulatory, then it becomes a lot more difficult. So the cardiologist has to come to the patient's home or the resident to turn it off. We have to be trained in how to do it because it's actually done by a computer and a device. So we have to learn how to turn it off ourselves if the cardiologist isn't willing to come to the bedside. Or the manufacturer of the device has to have a representative come to the home and turn it off. So if they can do it early on in the game when they're still mobile, that's really easy. But later on, at the end of life, when they're bedridden, then it becomes a big deal. Now, the magnet that we often talk about and use has to go over the Pace defibrillator, and while the magnet's on, it will turn off the sensing of the heart. But if you move the magnet off, then it goes back on. So it's not something that you can turn off the defibrillator by just waving this magic wand and it turns off. You'll only turn it off once the magnet's on the chest. But once the magnet is removed, then it goes back on. So it's only a temporary turning off. And so a lot of times if we have a defibrillator that we don't turn off and we want to have the magnet nearby, then the magnet has to stay with the patient's home because you never know when it's going to happen. So if they start having shocks at any time, then the magnet has to be placed over the chest and stay on the person's chest, because as soon as the magnet's moved away, the shocking will start over again. Now, the bad thing about the magnet, it's kind of heavy. So again, if we leave it on, it's going to put this weight on the person's chest, which adds to the discomfort. So it's not something that is without consequences as well. Now, once the patient dies, then you can remove the magnet. So the magnet doesn't have to be on forever. Once the patient dies, you can take off the magnet and it won't shock a dead heart. So again, the magnet does work, but it's only a temporary thing, or it has to be constantly left on. Otherwise, once we remove the magnet, the defibrillator senses the arrhythmia and it will shock again. So if we think that we're worried or the patient may suffer, then we need to work hard to turn off or reprogram the defibrillator. And the magnet is a temporary fix. Okay. So the best way is just to ask what the thoughts are and just kind of educate the family and the patients, and they'll decide whether they will want it on or not. I think we've had defibrillators in the past and we didn't turn it off. And so far we haven't had anybody experience shock. So it doesn't mean that if a person has it and they die with it, that it will shock them, but potentially it could. And so again, looking at the consensus of all the hospices that were interviewed, most people would turn it off if they knew how or were aware of it. But a lot of times it's not turned off, and patients still do fine, but they could get shocked in the process. So part of it is just education and making sure that everybody's on the same page in terms of what's best for the patient. So that's kind of defibrillator in a nutshell.
Thank you, Dr.